Welcome to Healthcare Blind Spots. I'm Vivian Kopsinger-Birchall, your host, and my special guest I'm truly excited to have her here is Dr. Yolanda Kirkham, a gynecologist in Canada, our neighboring country. And I won't do justice by doing the introduction, so I'm going to welcome Dr. Kirkham. First of all, welcome to the show, Doctor.
Thank you.
I'd
So
like
great
to
to talk to you again.
it's a pleasure and an honor. But before we kick this off, would you please introduce yourself kindly? Tell us what you do and how long you've been doing it.
Excellent. Thank you, Vivian. So I'm Dr. Yolanda Kirkham. I'm an obstetrician gynecologist in Toronto, Canada. I've been working in women's health for over 20 years. As an OBGYN, I deliver babies, I do gynecological surgeries. I also have a subspecialization in pediatric and adolescent gynecology, so I deal with that population, but generally we'll deal with women, teens, from childhood all the way to postmenopause.
Excellent. And you're the perfect person to have our conversation today as we observe a Women's Month. And our topic is going to be around women's health, which is a huge, huge issue, not just in North America, but across the world. And I think we're just going to dive into some of the key things that prevent women from accessing healthcare. And I think my first question to you is many women grow up without proper education about their reproductive health due to cultural taboos. How does this lack of knowledge affect their ability to seek care? That is in your experience, and how can this be? What can be done to change this?
Well, this is definitely a global issue and not just in our own backyards, but the lack of education about our bodies leads to some stigma about actually raising those topics. Sometimes you hear about girls and they start bleeding and having their period, and no one's actually told them what to expect. So it can be very alarming when they start bleeding. Or sometimes they learn from their friends, and that there might be some dis and misinformation that they're receiving. Certainly, when people have lack of education and awareness, they're also not aware of some of the help that they can receive. And so there may be a delay or delay in care or not willing to get care. And sometimes if their parents or other loved ones or those in school are not as supportive, they may also not realize that there is actually a wealth of information and wealth of care that's available to them.
Right. And you open it up by talking about menstruation. And I'll just piggyback off that. That menstruation is one of the topics that is really off limits when it comes to talking about reproductive about women's health. That is tied also with the sexual health and infertility, and these are stigma or are issues that are very stigmatized. So, how does this stigma affect these women seeking this care, and how can we as women, normalize talking about these issues and normalizing the discussions?
Yeah, I think it starts at home. And, menstruation, for example, affects us 450 times in our lifetime, right? Happens every single month. And it not just affects that person, but it affects everybody around them, right? It can affect their family, it can affect relationships. If it's very painful or very heavy, it affects that individual's ability to go to work. And that can affect their workplace situation as well. So for something that happens so commonly, and to so many people, it's really important that we do talk about it. And that's why there are days around the world like Global Menstruation Day or Menstrual Hygiene Day to bring awareness to these issues. When we have the lack of ability to talk about it, this can lead to also barriers to having things like menstrual hygiene products. We know that a lot of people, again, in North America, even, and we're not talking about just third world countries, don't have access or money or finances for these. Products that they really need. And so that spirals also into lack of going to school or lack of going to work and affecting productivity.
Right. And when I think of also menstruation, I want to go beyond just the regular menstruation. And over
Mhm.
the past few years, I have been, immersed myself in projects around cervical cancer, which is a women's health issue, which is which has to do with also bleeding. And sometimes people don't see the symptoms because they think it's regular menstruation. So I guess one of the when we talk about some of the sexually transmitted women's health issues or health issues, uh, what are some of the what trends have you seen when it comes to sexually transmitted infections and the way we as women react to them or not even understand them?
Yeah, you raised a great point. So, sexually transmitted infections are always present, and not just in teenagers. And people think it's just in teenagers, but sometimes, for example, when people have gotten into new relationships as adults or they're divorced and dating again, they forget that they also need to protect themselves from sexually transmitted infections. And the best way of doing that is using condoms, but also being tested before and after new partners. And again, it's not just a women's health issue because if people are having heterosexual relationships, it also affects men. So it really affects all people. And so we're not just talking about the most common ones like chlamydia, gonorrhea, but people seem to have forgotten about HIV, for which there is also pre-exposure medication and post-exposure medication that they can be taking, and they can talk to their healthcare provider about that. Things that are rare, like syphilis, are actually on the rise again, too. So, again, all of these can be prevented with screening and with condom use. And one of the most important things is that one of the cancers related to sexually transmitted infections is actually preventable with the HPV vaccine. So the human papillomavirus is now what we have discovered is actually responsible for cervical cancer. And cervical cancer is the fourth most common cancer in women and is now very preventable. And that's why we're trying to vaccinate young people, boys and girls, before they're sexually active.
Right. So, which is a great segue into my next question because it ties into all these things that you've pointed out. The stigma, women's health issues in general, a lot of misinformation goes around when it comes to women's health, when it comes to sexual health, when it comes to cancer. So, as how misinformation also about contraceptions. So, in your opinion and what are some of the most harmful myths? Actually, I should say, in your experience, that you've encountered, and how can we contribute? How are they contributing to the chaos that we see when we talk about women's health or when we explore women's health? And how harmful are they, and how can we really make sure that we avoid them?
So I do think it's important that people seek information from reliable sources. So always be a little bit wary. Is the person giving you information trying to sell something? Or sometimes because they know people have fears or stigma around something, they may be actually profiting from that fear, especially, for example, now around menopause, which is a hot topic, but there may be wellness products that you may not need that are really there to be sold to you. So number one is getting good information from reliable sources. And then number two, some of those myths, I think one of them is that birth control is only for birth control. Hormones actually run our entire bodies, whether it's for your thyroid, for diabetes and blood sugar. Insulin is that hormone, and in women's bodies, it's estrogen and progesterone. However, we don't market medications like that, right? They've called it the birth control pill. As a gynecologist, we actually use these hormonal medications for period control, and so I think one of the things that is harmful or a myth is that painful periods are actually normal or very, very heavy periods are normal. So both of those are not normal situations because women can get very tired from bleeding a lot. And then for endometriosis, which is a condition where they have very debilitating periods where then they can't go to school or work, and it can be daily or extreme pain just during their period. These are all treatable conditions. And because they're all driven by the hormones in our body, hormones and special formulations can help to decrease flow and decrease pain. And one other harmful myth around that is that using these medications will affect you in the long term in a negative way. And in fact, when people use hormonal contraception for 5 to 10 years, it actually cuts the risk of uterus and ovary cancer by 50%. So that's a significant fact that I wish more people knew about. And also that sometimes it can actually protect your fertility. So for example, with endometriosis, preventing that from progressing can also help improve their fertility.
Right. Thank you for mentioning, for giving, telling us about that. And one of the things that I can't stop thinking about as we're talking about access to women's health care is the invasive, for lack of a better word, medical exams or gynecological exams that many women feel uncomfortable about. And I've heard this conversation as I've carried out research for cervical cancer, some of the things that are keeping women away, say from pap smears. So my next question to you is around that area. How can doctors and the healthcare system ensure that women have agency, have comfort, and informed consent in their reproductive health decisions?
Yeah, I think that's a wonderful question. And I think when you find the right doctor, you won't be disillusioned. A lot of medicine now is really centered around the patient and patient-centered care. So, for example, trauma-informed care is a new, a practice that's been in medicine for a few years, but it's really just acknowledging that a lot of people have had trauma, whether it's, childhood adverse experiences or in relationships with intimate partner violence or some kind of trauma, unfortunately, or assault. And so realizing that there's that high percentage and treating everybody as if, to ensure their comfort and agency and autonomy and being able to make decisions or telling the healthcare provider to stop if it's uncomfortable, like that's really important to us. As gynecologists, especially, we're very sensitive around that, making sure that people have a comfortable area in the office to change and to also be draped properly and to be asked for consent to proceed. Even in teaching kids now, we're, at schools, people are making sure that their kids learn about consent, even just in, daily play, and be making sure that people are willing to engage. And I think it's very important that healthcare providers walk people through the procedure and give them a good understanding of why something is being done and also why or what the consequences are if that's not done. Of course, healthcare providers are there to make sure people come back to seek healthcare. We're in this area because we want to help people and we really don't want to hurt people. And for me, it's very important to make sure anything we do is really try to be as pain-free as possible. So whether that's medication beforehand or freezing medication given during procedures. And sometimes I think if someone's had a bad experience before, obviously it's uncomfortable to have to go through that again. But I think finding the right healthcare providers that hear you and that can change that experience for you are really, really important. And sometimes talking to friends who have found a good experience is another way to find a healthcare provider that listens to you and can build that trust for you.
Right. And then one other thing that I really I want to ask to consult with you is about the conflict between traditional beliefs, religious beliefs, and modern medicine or modern interventions. We find that this conflict is a barrier to access to healthcare in many ways. And as gynecologists, I believe you meet people from all cultural backgrounds. So I guess the question is, how can the healthcare providers like yourself build trust and integrate these culturally sensitive approaches to care?
That's an excellent question. And I think it's really important that we acknowledge some of the systemic biases in medicine. And medicine is now doing a good job of that in the training and also for all of us to keep up to date. It's really important to be culturally sensitive and understand where people are coming from. So oftentimes I'll ask somebody, oh, how come you think that way, or what experiences have affected your thoughts about that? Because sometimes understanding where someone's coming from can really help you then guide your care. So I think it's really important in our healthcare system to actually have diverse healthcare teams and have representation, so that when people come for care, they feel like there's something they can relate to. And it's important to address those biases that may be inherent in our healthcare system, so that we can take down some of those barriers for people to seek care.
Right. And then you and I have a deep appreciation for communication when it comes to healthcare as a bridge between, the medicine and the people. So, and we're seeing, there's been lots of advancements and innovation with and evolvement of communication platforms. People are seeking information in very short reels, 1 minute or even less, 30 seconds. In what ways is this a double-edged sword for healthcare, especially fighting all the things that we've talked about, misinformation, building trust, and how can the healthcare, providers and healthcare system adapt to these media platforms or work around them, if for lack of a better word?
So I think we need to continually meet people where they are. So if the trend is going towards shorter bits of information, then healthcare systems, clinics, they need to work towards that. And whether that's updating their technology, or finding people that are very good at this knowledge translation to do these activities, will be able to help reach people in a better way. People, I think, now have a shorter attention span due to social media and short reels. And if that's the case, then we need to use those platforms to better reach the population.
Absolutely. No, I mean, women's health is reliant on a lot of that because we are huge consumers of social media. As we wrap up this special edition on women's health, is there something that we haven't addressed in this very short interview that you'd like to tell us about how to really make women's health a priority and how to support women in healthcare?
Well, I think no matter what stage you are in, whether you're a teenager entering puberty, or you're in your reproductive years seeking fertility help, or you're a new parent, or going into menopause and perimenopausal, like all of these transitions can be assisted. So if you're having any difficulty, whether it's with fertility, with heavier painful periods, with mood or lack of sleep or brain fog or other issues around perimenopause, there is help out there for you. And it's finding your right primary care provider or gynecologist to help assist with those transitions, because there is very safe medication to help adjust the hormones, because these are what fluctuates with PMS or perimenopause or before or after pregnancy. And all of these things can make you feel better and feel like yourself if you're
Yeah.
struggling.
Oh, sorry. Yeah. So I know that I thought I was going to wrap up, but you've been mentioning one thing that I think many people don't talk about, that is perimenopause. Could you please tell us a little bit in detail what that is, what the symptoms are, and what the challenges are to when women are trying to manage it?
Mhm. So menopause is when you have your final period and then you have a year of no more periods at least. So that's menopause. It usually happens between 51 and 52. But the years 5, sometimes 10 years around that time, people can struggle because their hormones from their ovaries are dropping. So that includes estrogen and progesterone and a little bit of testosterone as well, which women make too. And so I had mentioned that hormonal fluctuations are what makes us feel not like ourselves sometimes and can be quite uncomfortable, or lead to things like issues with sleep, hot flashes, brain fog. And around perimenopause, menopause, you can also have things like joint pain, changes in your hair, decreased muscle mass. So all of these things, including heart health and bowel health, these can be affected. And so because all of these symptoms are related to a drop in the hormones, sometimes adjusting and maybe adding back some of those hormones in the form of, we call it now menopausal hormone therapy, can can be effective for a lot of people. I've also haven't mentioned vaginal dryness, but a lot of people suffer from that and urinary incontinence the older they get. So the farther they get from menopause as well, in their 60s and 70s, a lot of people can still suffer the vaginal symptoms, and that's very treatable and very important to treat early on. And sometimes it's not with medication by mouth or on the skin, but actually local medication in the pelvic area to help them improve those parts of their life.
Well, you have kind of opened a can of worms, and now you've talked about vaginal dryness. That is, there are many people who are using the, women's stigma about that to really tap into what we call the she economy to really manipulate women, and also what not manipulation is not the word that I'm looking for, but they take advantage of women. So, what are some of the best ways women can make sure that they're not falling prey to predatory practices in terms of, or predatory products out there to manage this vaginal dryness?
Yes, so for vaginal dryness and odor, like there's so many products out there, they deem themselves feminine hygiene that are really unnecessary. So water is the best for cleansing, or a gentle cleanser, but women should not be using douches. They shouldn't think that everything is a yeast infection as well. So a lot of people also have vulva skin problems. So they may have lichen sclerosis that can cause itch and pain and a feeling of dryness. But a good way to start is there are vaginal moisturizers that you can get at the drugstore. So those can be helpful, especially if they have hyaluronic acid, and that's like the non-hormonal, if some people want to start off with that. And then they can talk to their doctor about any other help, because there's lots of different products with vaginal estrogen that's not absorbed into your bloodstream and really just used locally, because sometimes people can have tearing and pain, pain with relationships, but also we know that vaginal estrogen actually decreases urinary tract infections by more than 50%, especially in older women or mid-age or older women. So that's a very important fact for people to know. And again, not falling prey to people trying to sell you things that you may or may not need, right? So having evidence for things that work is really important. And in medicine, a lot of studies are done before medications are approved for use.
Well, again, see, there is a lot that we can talk about with men's health. It's so broad.
Mhm.
There are things that we haven't touched about because women at some age start losing their hair, which is also a big area of stigma, and we've fallen prey to different hair products and hair accessories that are sometimes harmful. So I guess we can go. That's an excuse to bring you back at some point. We're trying not to make this very long, but is there any final word you have for us for this particular episode about women's health?
Well, I do think perinatal mental health is another large topic. In Canada, for most people who are not self-employed, they get 18 months of maternity leave. And when I hear in the US that it can be as short as 2 weeks to 6 weeks, like, it just breaks my heart, knowing that people haven't even started establishing breastfeeding or having childcare available. So I think that the area of perinatal mental health and perinatal support is really important, especially around feeding the moms and the babies, and ensuring that other partners are involved. I think that that's a really important area too.
Yeah, again, you've reminded me that I need to bring you back to just talk about policies that can be in place to support women, which could be a week-long conversation. But for this particular episode, I would like to thank you, Dr. Kirkham, for making the time to come be a guest on Healthcare Blind Spots to talk about women's health. And thanks for all that you do for women.
Thank you so much, Vivian. It's great to talk to you again.
And to our viewers, thank you for watching Healthcare Blind Spots. Happy Women's Month. Till next time.